I use LDN with my pediatric patients. It start at 0.5 milligram in pandas to eczema. Do you start lower with pediatric patients? Oh, that's a great question. Um, Peds usually metabolize quicker than adults. So the cool thing with pediatric patients is that we can also use a transdermal product, which is sometimes easier. So Dr. Brian Udell out of Florida, an amazing individual. I remember him saying back, oh, I think it was like 2016 was the first time I listened to him. He didn't realize that low dose naltrexone was used in adults. He'd been using it in peds for quite some time for kids on the spectrum and a wide variety of other issues, but he didn't know it was used in adults. So he was just as amazed as well as those practitioners that were prescribing for adults that it was being used in peds. So Dr. Jacqueline McCandless, Dr. Ian Zygon, there were a few others, published some studies about using low-dose naltrexone in children, young children, like before a year, 10 months or so, all the way up. And they were using it quite a bit for kids on the spectrum, but also for some other autoimmune issues, whether it's pandas or eczema. And we are seeing it used in pediatric cancers as well. So you can start low and move up. Dr. McCandless noted that with the transdermal, there's a 2.64-hour delay in the onset of activity. It has to be used in a transdermal base. I cannot emphasize that enough. There's a huge difference between topical and transdermal. Transdermal can replace oral. Topical does not replace oral. Topical can be used in conjunction with oral, but we don't use just topical. So topical sits on the surface. It might go down to the dermis, but it doesn't necessarily transverse the dermis and go into the dermal layers or even into the bloodstream. Works more localized. Transdermal means that it goes through all 8 layers of the skin, gets delivered into the blood supply, so the blood supply can then send it out to the entire body. Starting with 0.5 milligrams, sometimes parents are a little bit more open to that, but you don't necessarily have to start that low. Again, it's all about the individual and how they're going to respond. Dr. McCandless and Dr. Zygon's early studies were, they actually started a little bit higher, and I think most of their patients stopped at 3 to 4.5 milligrams, someplace in there. Not all of them were on the same dose. It was a small study. It was under 20 kids, but they had tremendous success with that.